Hi, do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with SimplyNature Power Pack, a 5-day combo pack of SimplyNature Pea Boosting and SimplyNature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, Tahiti. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, try ko daw itong yung PPARs. Pangalawang gabi, naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun, lumabas talaga na ganyan, napakarami talaga. Sunod yun, 3. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganun. Pag nagsalita ako, parang kung halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag magandang tinanggal ko na yung sa cholesterol ko. Hindi na ako, pero yung sa cholesterol, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin. Wala akong nararamdaman na. Parang ngayon, bumili pa ako ulit ng tablet. Oo. Kasi sabi ko, para para lumakas talaga sa akin. Kasi nararamdaman ko talaga na maganda. Liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARs times morning at saka gabi. Pag numulog ako, hindi ko na siya mararamdaman. At saka kinakapa ako siya. Parang nawawala, parang wala na. Hindi ko mahawakan. Okay? SimplyNature.
Father ko muna, PPARs vial para po sa prostate cancer niya. Kasi medyo malala na Stage 4 na siya. Then, nabasag pa yung spinal cord niya. So, lumpo. Nalumpo siya, hindi na makalakad, bedridden. Ang putla na niya Medyo nakakatakot na. So, while taking PPARs, little by little, yung pamumutla na namumula na yung pisngi, nakatulong din sa appetite niya. Din syempre sa bowel mo. Kasi mukhang isa yun sa na-paralyze other than his legs. Pati yung mga SGPT, yung mga cholesterol, nag-i-improve din. Then sa energy levels din, kahit na-ridden siya, makulit. Since maganda yung effects ko, kasi siya naman hypertension, na vertigo rin siya dahil sa hypertension niya. So sa kanya, soft gels lang. Yun, alongside ng maintenance niya yun, yung PPARs products. Then, all in all, maganda. So, siyempre, since naganda kami, di ako rin nakabawas sa stress ng tulad. So, ganda. Ganda eh. So, super recommended eh. Ganda nga eh. Kahit headache, babawasan. Super recommended.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. May para siyang matang isda lang. Maliit na... tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko bakit hindi niya daw alam anong reason. So sigurado ko dahil may baka dahil yun lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot. Nagkaroon siguro siya ng yung nerve sa paa na damage na. So hindi niya nararamdaman na natapakan pala siya. So probably yun siguro yung tapagat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So nagkaroon siya ng lagnat on and off. So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD. Chinek, binigyan ni reseta boss. Pero kapiranggot lang ang tiningnan. Tapos in-advise na lang kami, linis. At 7 days na gamutan ng antibiotic. After 7 days, tumala lalo. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor?
Ang plano sa kanya ay putulin. VKA or the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Sabi na may tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then as needed, religiously. So yun ginawa namin, twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, plan na hanggang makita na hindi na ulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARs. May kamahalan. So, sinugal ko para kasi kailangan kung hindi mo isusugal yun, baka maputulan talaga kasi kahit naglilinis kami ng paa tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. and the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi, ano siya dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARs, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos, yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARs, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran eh. So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, yung lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, nagkaroon gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARs.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of SimplyNature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of SimplyNature, PPARs. And I trust SimplyNature.
We're always with you from start to finish.
Good day, everyone, and welcome to another episode of Simply Nature Answers. We're thrilled to have you with us today for this exciting, relatively new series where we'll provide worthy insights and answers to the pressing health-related questions. I'm Sheila, and I'll be one of your hosts for this afternoon.
Now today it's Jenny Lay. We're really excited because today's S&A topic is entitled Why Take PPARs While on Maintenance Medication? So if you've been curious about how Simply Nature's PPARs products can make a difference in your metabolic illness journey or even cancer, you're in the right place. Because our goal today is to help you gain a clearer understanding of how PPARs technology can be integrated into cancer and metabolic illness treatment, empowering you to make more informed decisions, whether you're considering different treatment paths or just want to know more about Simply Nature's offerings. We're here to guide you.
Throughout the webinar, feel free to send in your questions by dropping it on the comment section. We'll be answering as many as we can during our AMA or Ask Me Anything session at the end. So don't hesitate to engage with us. Now, leading to our discussion this afternoon, our distinguished health expert. First, I'd like to introduce a successful entrepreneur and seasoned international speaker on a wide range of topics from personal success to healthcare. He is the CEO and founding director of Simply Nature International and a passionate advocate of integrative health solutions. Please join us in welcoming Mr. Shyan Lim. Let's all watch this.
Hello everyone, welcome to another episode of Simply Nature Answers. I'm Shyan, your PPARs expert from Singapore, and today I'm going to cover the very important topic of why should I take Simply Nature PPARs while I'm on maintenance medication? Well, today, if you're on maintenance medication, you're most likely suffering from one of these three highs: high blood cholesterol, high blood sugar, or high blood pressure. So that's your diabetes, your cardiovascular issues, and your hypertension. Now, if you're suffering from any one of these three, your concerns while on maintenance meds is probably these few things, these three things actually. What are the side effects of these maintenance drugs that I'm taking? Number two, why is my dosaging increasing year after year? And if you would notice, if you started off as high blood cholesterol, you're very likely to develop diabetes. Or if you're taking diabetic medication, it's very common that you will develop high blood cholesterol as well. So not only are you worried about the side effects of the drugs that you're taking, you're also wondering how come your dosaging is increasing and the number of medication that you're taking is also increased. Certainly, last but not least, you're probably wondering, can I get off these maintenance meds? So I'll tell you right now, the good news is yes to everything. Let's tackle the first two together, which is side effects and long-term increase in your dosaging. These two are actually related because the maintenance drugs that you're taking right now works on the symptoms. It doesn't work on the root cause. That's why year after year, the dosage keeps getting higher and higher because you did not solve the actual problem. It's like having a bathtub, right? And then the tap is leaking, so it's always filling up your bathtub, and your medication, your drug is like a tabo that you're scooping the water out, right? The leak gets worse and worse every year, so your tabo gets bigger and bigger every year because you have to scoop out more and more water. The medication you're taking now isn't stopping the leak, right? You're simply changing a bigger and bigger tabo. Now, Simply Nature PPARs works differently. We don't give you a bigger tabo. We actually tighten the leaky tap so that the water doesn't leak into the bathtub anymore and you won't overspill, and then you won't need a tabo. And if you notice it, right? If I reduce the leak, the water build-up will be slower. Your tabo can be smaller, which means actually as time goes by, your maintenance meds, we can reduce the dosage of your maintenance meds. So if you lower the leak, guess what? You need a smaller tabo because the water isn't filling up that quickly. And that's exactly what Simply Nature PPARs will do. Now, To cut it short, if you have questions, ask me during the Ask Me Anything segment so that I can keep this part very short. Basically, how SimplyNature does that is that SimplyNature PPARs activates PPAR pathways, and PPAR pathways actually modulate your metabolic pathways. So it actually sort of resets or returns the way your body burns energy, which affects blood sugar, blood cholesterol, into a more to its original state. So it's like turning the tap off, making sure it doesn't leak anymore. So that's how it works. Another thing that SimplyNature PPAR does is it reduces inflammation. Inflammation basically also causes your tap to leak, right? Inflammation causes a lot of issues in our body that leads to metabolic syndromes. So not only do we modulate the metabolic pathways, we also reduce inflammation. So these two together will work on your root cause of your disease that you are fighting with your maintenance meds. Okay. Last but not least, we did ask this question: can you possibly stop taking maintenance meds? The answer, of course, is yes. Over time, with the monitoring of your doctor, you can reduce your maintenance meds as your blood cholesterol and blood sugar returns to normal, and probably in about 3 to 6 months, you could possibly, with your doctor's advice, actually go off your maintenance meds. Okay, so to sum it up, you're asking yourself, are there any side effects of taking maintenance meds, and why are my dosaging going higher and higher? Can I stop my dosaging from going higher and higher? And last but not least, can I actually ever stop taking maintenance medication? The answer is yes with SimplyNature PPARs, because number one, unlike drugs, we are not working on the symptoms, we're working on the root cause. So over time, your dosages, instead of going up, will go down. And if you are disciplined enough and consistent enough with SimplyNature PPAR protocols, you can even reach that point where you don't have to take your maintenance meds anymore. Of course, do this in partnership with a healthcare expert or your doctor. So if you want to know how you can do that, simply ask me during the Ask Me Anything segment, which we are going into right now.
Thank you so much, Mr. Shyan Lim. I'm sure that a lot of you have learned so much in that discussion, and a lot of you has got a lot more curious about PPAR. So let's not keep you waiting. To answer your questions this afternoon, let me call on once again our experts. First off, I'd like to introduce again our CEO and founding director of SimplyNature and PPARs expert from Singapore, Mr. Shyan Lim. Next,
Hi, Shyan.
good evening, good afternoon, sir. Now, next is our resident pharmacist and one of our dearest client service officers here in SimplyNature. You all know her. Let's all welcome Miss Jenny Macanjola. Hi, Sir Shyan, and hi, Miss Jen.
Hello, Sheila. Hi, Jen.
Hell today, everybody.
Okay, Sheila, let's go on to the questions.
All right. Okay. So for our first question, this afternoon, thrown to us privately by one of our viewers, how can someone determine if they need PPARs as part of their maintenance medication plan? This is a good question.
Okay, the answer is everyone needs to take PPAR tablets. Okay, the answer is that. All right. Number one, I don't have metabolic syndromes. Okay. My blood pressure a bit high from stress and lack of sleep, all right? But I don't really have high blood cholesterol, high blood sugar. Definitely have not had it for more than 20 years. But I'm still taking PPAR tablets. I'm still taking PPAR tablets because of the other benefits, right? Okay, but let's talk about those on maintenance meds. No matter what is your dosage of maintenance meds, the moment you're on maintenance meds means that you have blood sugar, blood cholesterol issues or challenges, right? Now, why do I say issues or challenges? Because sometimes for lifestyle diseases like metabolic syndromes, that includes diabetes, blood cholesterol, and high blood pressure, hypertension, the cause is quite hard to find out. Okay, the cause is quite hard to find out, especially if for example, high blood cholesterol. It could be hereditary, it could be many, many reasons, from age to stress to a lot of reasons, all right? So whatever your reasons, as I've explained during the video just now, PPAR modulates. It switches on your system. It returns your own body system back to normal. It's like a rehabilitation, right? It's like a resurrection of your broken system, your body's broken system. So for blood sugar, what it does is it makes your cells sensitive to insulin again. It makes your cells sensitive to insulin again. So unlike drugs, it doesn't by force push your blood sugar level down. So no matter how much PPARs you take, you will not have hypoglycemia. All right. So it's impossible to get hypoglycemia from taking PPARs. So what does that tell you? Yet it can lower your blood sugar level. But you will never have low blood sugar. So why is that case? Because it doesn't force your blood sugar down. All it does is help your cells to function normally, and then your cells will use the sugar that your body intakes, and that will normalize you. Now, for those of you who are on mild, right? Sheila, can you read the question again, just so that I make sure I get it on the spot?
Sure. Question is, how can someone determine if they need PPARs as part of their maintenance medication plan?
Okay, right. So as long as you have a maintenance medication plan, you will need to take PPARs. So what it will do is that it will stop your maintenance from getting worse. That means your dosages will not keep increasing with time, which is what will happen if you take any maintenance med. Over time, your dosage keeps increasing. Okay, number two, that we are actually aiming to get you off your maintenance meds. Okay, so that's another reason. That's why as long as you're on maintenance meds, you should be taking PPARs. Now, how do you get off your maintenance meds? We will go progressively. So you take PPAR tablets with your maintenance meds, but very important, monitor your blood sugar level. So for now for blood sugar level, very easy, right? There are home test kits that you can easily do. Not very painful at all. It's like a sharp mosquito bite. That's it. And then you can test it at home, and it's very accurate. And you can even do it a few times a day if you need to. All right. So do monitor your blood sugar. If you notice that your blood sugar is normalized, you might want to reduce the amount of maintenance meds you're taking. Okay. Just like so you monitor for a few days. Oh wow, I'm taking PPAR tablets. My blood sugar level is good. It's even better than my maintenance meds. Okay, because what most diabetics, what happens is this: even though you're on diabetic medication, your blood sugar is still always a little high, right? It's still always a little high. Okay, so what happens is when you're on your maintenance meds and PPAR tablets, suddenly your blood sugar is perfect, very nice, or maybe even slightly lower than on the lower end of the average range. Then you can let it stabilize like that for 2-3 days. Then you know what? Then you can lower your medication by a little bit. Maybe you lower it by 25%, right? And then take your PPAR tablets, monitor your blood sugar, okay? And then step by step, over a period of about maybe a month, you can wean yourself off your maintenance meds. Always advisable if you are not mild case, if you're very serious diabetes, all right? So like your diabetes is very high, like 9 or 10 or 11, all right? Then you know what? I would definitely advise you, have a consult with a doctor. I would recommend Dr. Johnson because he actually knows how to use your PPAR tablets together with your medication. But if you are borderline 7, 8, it's fine because even if your blood sugar goes up a little bit, it's still manageable. So there's no worries on your side, okay? So that's everybody should take. And I am don't have metabolic syndromes, but I take it because I don't want to develop metabolic syndrome. So by taking PPAR tablets, you keep yourself free from high cholesterol and being diabetic. And the last advantage is Meron is anti-aging. I'm 50 years old this year, and hopefully I don't look 50 to you. Okay. Any comments from our pharmacist?
Miss Jen? That's correct, Sir Shan. PPARs can also be used as prevention, and PPARs are generally safe when used alongside with most medications because it's 100% natural. It's clinically tested without any contraindications, and even healthy people can take it for general health maintenance because it's superfood. It's rich in essential vitamins, minerals, and phytonutrients. So especially if you're kind of stressed at the moment with the holiday rush or you're a little athletic, you can take.
Yeah, that's right. PPAR tablets is actually the best basic supplement. You know, I will go so far to say it's definitely better to take PPAR tablets than multivitamins. Okay, unless you know you have a specific, like you lack a particular type, you lack iron, then you take iron pill. But if you're just taking multivitamins for health, PPAR tablets beats it hands down. Okay, it's just better for your body. And everyone here on our broadcast is actually taking the tablets. Sheila is taking. Ms. Jen, our pharmacist, actually has immunodeficiencies. So she's actually, Jen, you are psoriatic, right? Very serious psoriasis.
Yes, sir, with arthritis.
And with arthritis, so with PPAR tablets. So, you know, all of us are speaking from experience. So all of us are actually speaking from experience. I'm the only one here. Me and Sheila are healthy. Jen not
right.
saying that you're not healthy, but you know, Jen does have her medical condition that she is managing with PPAR tablets. Oh, I want to say good afternoon to Miss Janet from Child House. All right. So good news, Janet. Wanted to let you know. I'm not sure if Beth has contacted you. We are sponsoring 2 more of your kids from Child House on our PPAR protocol. So we always love to work together with Child House. All right. And for everyone's information, Child House is a halfway home for cancer kids. So we support those cancer kids that are going through chemotherapy with our SimplyNature PPAR protocols.
Excellent. That's true. Well, hi, Miss Jeanette. And for our next question, this is coming from Miss Ethel Manaloto. Can we stop taking the other supplements like omega-3, B complex, vitamin C when taking PPAR's tablet?
Actually, the answer is absolutely yes. Okay. Now, let me be a bit specific. Okay. To answer Miss Ethel. Mr. Ethel, if you are taking omega-3, B complex, vitamin C without prescription, that means you don't have a nutritionist that say, Mom Ethel, you really are lacking in vitamin C. So I want you to take vitamin C. Okay. For example, if that's the case for you, then take both vitamin C and PPAR tablets together. All right. The good thing about PPAR tablets is that because it's natural, even if you have too much vitamin C, your body will displace it naturally. So it's very different from taking synthetic or concentrated vitamins and minerals. Yeah, okay. So, and anyway, it's very hard to overdose on vitamins and minerals, okay? And you'll never overdose with SimplyNature PPARs because it's in pure vegetable form, all right? Which means, and very unprocessed, very natural. So it's like no matter how many carrots you take, at most you turn a bit orange, but the moment you stop, you become normal again. Okay, so if you are not under specific prescription, then yes, it's absolutely fine to stop taking your omega-3, B complex, and vitamin C because everything that you are mentioned is actually found in the PPAR tablets. And the PPAR tablets will have extra. Okay, so if you are taking just pure omega-3, B complex, and vitamin C, most of the time, what you're taking is probably a concentrate, okay, an extract or concentrate. One of the disadvantage of taking a extract concentrate is this. It's okay to take if you are for a short term, like 1-2 months, right? Because it's a your body may be lacking omega-3. So that's why your nutritionist or your doctor prescribe it to you. So usually after 1 to 3 months, you're topped up. Now, the challenge or the problem with taking non-natural supplements is this. You will stress your kidney and liver. So a good example is calcium pills, okay, for stronger bones, right? So people who take a lot of calcium supplements end up with this problem called calcification. Okay, you can Google it. It's actually a problem for people taking calcium supplements because you are taking too much calcium supplements in a too concentrated form, and your kidney and liver is not designed to process so much. You know, to all our listeners out there, don't forget everything that you put in your mouth, your liver and kidney has to process it. You do not use all the vitamin C you take. Neither do you use all the iron and calcium that you take. It will go through your system. Your liver and kidney has to process them. So if you're taking mega doses of certain things over the long-term period, you might be stressing out your liver and kidney. That's why everybody understands, right? In the end, instead of taking multivitamins, they will say, eat your vegetables, right? Eat the actual carrot, eat the actual kangkong, eat the actual apple, eat the actual banana. It doesn't stress your system the same way as taking a supplement, right? But I want to answer. Hold on, huh? Oh, I saw a question by Naomi. All right. But to answer your question again, Ethel, yes, you can. All right. In fact, you will get omega-3, B complex, and vitamin C in your PPAR tablets. Probably not at the same level of concentration that you get from these concentrated vitamins, but you'll get it at a level that your body can absorb naturally and absorb. So just take it, you'll notice the difference. You notice the difference. And if you realize, for example, when do we actually need more vitamin C? Actually, if you're doing sports, but vitamin C actually helps with recovery. Okay, so if you're doing excessive intensive sports, then you might want to supplement vitamin C. But if not, just taking a PPAR tablets, try it for 2-3 weeks. And if you feel stronger and better, then that means this is sufficient for you. Right? But the good news is, yeah, I don't take other supplements. If I do take, I actually take like Chinese herbs, especially for like men who are over 50. So if you study a bit of TCM, you understand that at different ages, we need to nourish certain organs. So for guys, we need to specifically nourish our liver, our kidneys. Okay, so we will take supplements specifically designed for kidney and liver.
Right. Thank you. Wisdom, would you like to add anything?
Yeah, in addition to that, Sir Shyan was speaking about calcium supplements. It actually also increase your risk for kidney stones made of calcium oxalate.
Yes,
So,
absolutely.
so aside from PPARs, I'd also recommend another SimplyNature product, which is the Cleansing Plus. It's perfect for detoxification, especially when when you have digestive issues or you're taking maintenance medicines.
Absolutely. You know, having a clean GI, taking enough dietary fiber is actually very challenging, right, Jen and Sheila? I'm sure it's hard to get. Sheila, I'm not sure if you have trained Dominic to enjoy his vegetables. But I think it's generally very hard, even like for our business-to-business, head of business-to-business in SimplyNature, Sir Emerson, getting him to eat vegetables is like trying to kill him, right? So yeah, so because of that, most of us do not have enough dietary fiber in our body, and that affects your health tremendously. I won't go into it, maybe unless someone has specific questions about it, but it is so important to be regular. And now is the feasting season, Christmas. So I am sure you are going for party after party after party. This is the best time to buy maybe just even a 5 sachet or 10 sachet cleanse, or get a whole box, right? And anytime you go really partying and then you're going to take a break before, and then next week you're going for another party, yeah, detox, pull it all out so that you can eat again. Okay, so that's my advice, and that's another great product to and everybody can use it, and it tastes great. Okay, so Sheila, I'm going to interrupt you because Miss Naomi asked, can we take PPARs while on chemo drugs? Example, in the morning, 5 chemo drugs orally, then PPARs in the evening. The answer, Naomi, is absolutely yes. You are correct. In fact, tonight, I'm actually doing a doctor's forum, right? And all those in attendance are pediatric oncologists, okay? So what I will share with the oncologists is how to use our PPAR soft gels and powder and extract liquid for patients who are going for chemotherapy, okay, especially intravenous chemotherapy, because because intravenous chemotherapy, the patient will really feel it on the day that they pump the chemotherapy into their blood system, right? So we use that protocol. Now for you, because you take it orally, the answer is yes. I think what you have suggested, you take the chemotherapy in the morning, 5 tablets, then you take the PPAR at night. That is a very good strategy. Very good strategy. Let me share with you the reason why, right? Because most chemo drugs have a half-life, a very short half-life. Usually within 12 hours, it will do most of the work. That means the work of the chemotherapy is to damage the cancer cell, right? So you are, by taking it in the morning, by the time in the evening, most of the work of the chemo drug is already done. So now is a good opportunity to then strengthen the body, right? Protect your body. And then the next morning, your body is ready again for the next dose of chemotherapy drug. Now, for the sake of Naomi, I'm gonna share a little bit, okay, of what I'm gonna share with the pediatric oncologist tonight. Okay.
Wow. Okay.
Yeah. So what I'm gonna share is this. What PPAR extract liquid, extract powder, and soft gels do is this. It actually protects your cells from chemotoxicity. Okay, that means from the side effects of chemotherapy. What it does is that it protects the healthy cells of mitochondrial pathways. I'm starting to use big words. Okay, I mean, they're not big words. They're just words that unless you study pharmacology and physiology or pathology, these terms are not commonly used. Okay, now just to put it into simple terms, how chemotherapy kills cancer cells is usually by damaging the power supply of the cell. It will damage the battery. It will damage the generator of all the cancer cells. So without power, what will happen? Without power, the thing won't move, right? The thing will die. Okay. So that's how most chemotherapy mechanisms, they do it by different ways, but what they end up doing is damaging the mitochondria of every cell. So without power, that cell starts to die. Okay. Now, what PPAR does is that it protects the cell's mitochondria from being damaged. There you go. Now, the important question where all the oncologists will ask tonight, which is something that I'm going to answer right now, is, Shan, if you protect the cell from the chemotherapy, protect the cell from the damage of the chemotherapy, then won't it also protect the cancer cell? So not only am I strengthening the healthy cells, I'm also strengthening my cancer cells. No. Okay, I'm going to give you the reason. Are you ready, Naomi? The reason is PPAR mechanism only protects cells with intact, complete mitochondrial pathways. Cancer cells, you all know, right? Cancer cells are mutated cells. They're not normal cells. So they also don't have normal mitochondrial pathways. Because they don't have normal mitochondrial pathways, the protective action of the PPARs doesn't work on them. So in a way, the PPARs is like smart. It only protects the healthy cells. It does not protect the cancer cells. Scientifically, because I need to explain to oncologists, we have to be very specific to explain how does the PPAR tell the difference between a healthy cell and a cancer cell, right? It tells the difference. Healthy cells have complete mitochondrial pathways. Cancer cells don't. So the way the PPAR works, it only works when you have a complete mitochondrial pathway. So there you go, right? It will really only strengthen and protect your healthy cells, and it won't protect the cancer cell. So I hope, Naomi, I gave you a little bit of tidbit, all right? Going a bit, what's that called, in depth. I hope it gives you the confidence. So, however, I want to tell you one thing. If you are really on chemotherapy, if you're doing well on chemotherapy, stay with what you have. I will suggest actually that you explore taking the soft gel capsule, okay, because it's a bit stronger, right? Tablets is what healthy people like me take, or a person with mild diabetes, mild blood cholesterol. Now, for therapeutic effect, usually the tablets you have to take at least 20 micro tablets, for therapeutic effect. And since you're taking chemotherapy, you are not just wanting therapeutic effect. You want an extra strong to protect your cells. So I will encourage you to explore, speak to Jen, speak to Sheila to see if you would like to try the soft gel capsules and the tablets together. Okay, this is what we normally encourage for chemotherapy patients. Okay, now if you are doing very, very well with your chemotherapy, you don't feel any side effects at all. Okay, then and let's say, sorry, I just be truthful. Let's say finances are a bit tight because chemotherapy is cheap also, right? So you need to save money where you can, right? If your chemotherapy, everything is doing well, your red blood cell count is normal, okay, then just take the tablets. But at any time, if your RBC drops, okay, here's another good news that I will be explaining to oncos tonight. By taking PPAR extracts, the soft gel capsule, the powder, your red blood cell count will be maintained and even increased if it drops. Okay, so if at any point, Naomi, if you're taking your oral chemo, if your red blood cell count drops, your onco will be very worried, right? Because if your RBC count is low, you cannot continue with the chemotherapy drug, right? So you can then at that point, I would suggest you drop a note message, Sheila or Jen, and then get onto either the powder or extract liquid, and that will bring your red blood cell count back up. Okay, that will help. Okay, so there we go, Naomi. You made me share what I'm going to talk to the oncologists tonight on this program. We went more scientific and more technical than we intended. All right, but I'm sure it's interesting and it helps all the people listening. And thank you, Ethel. Thank you. I'm glad you learned something. Yeah.
Excellent. Thank you. Thank you, Sir Sean. Okay. Next question is that can PPARs help reduce the need for other types of maintenance medication over time? So
Yes.
definitely, right?
Was that half the question or there's another half?
No, that's actually the whole question.
Okay, the answer is yes. Okay, more than just metabolic. Okay, so maybe I get Miss Jen to share. Jen, no, you are actually a psoriatic patient, right? So, can you list some of the drugs that you regularly have to take? Because I even know Miss Beth, our HCS, that day I was so shocked. She has like a bag of tablets also. Then I found out she also has many sensitivities, very allergic to many things. So the moment our company has like a Christmas party or birthday party, she also has to take the medication or else she will flare up. So maybe you can share as a psoriatic patient, what are some of the drugs that you take? And once you're on SimplyNature PPARs, what happened? Were you able to lower the dosage or actually eliminate the drugs? You don't need to take them regularly unless, for example, you are very stressed by me or you took something that triggered your allergy, only then do you take the drugs. Yeah, maybe you can share a little bit.
Thank you, Sir Sean. Before I learned about SimplyNature, what I've consulted with the dermatologist, especially for the psoriasis, is just topical medicine. So it's steroids. But after I learned about SimplyNature and started taking even PPARs tablets and PPARs capsules, so I observed personally in my health that if for the hands and other parts of the body with arthritis, the inflammation and pain is minimized until it was gone. I was totally off the steroids at this point. I don't take steroids anymore. And if you could see from my followers, from my previous webinars, how slimmer I've got because I've stopped the prednisones already. The steroids,
yeah, because
also the painkillers.
Yeah, the side effects of drugs is usually putting on weight.
Yes.
Yeah, so yeah, you can see, I think suddenly a lot of people want to take PPAR tablets. Not because of their health condition, because they want to slim down. Okay, yeah, it does have the slimming effect, all right? No, that part is also true because it will modulate your metabolic pathway, so your body will burn energy more efficiently, and that helps you burn fat, okay? Yeah. So as Jen said, this is to answer that question just now. Will it help you get off your maintenance meds? Yeah, it will help with the metabolic, but more than that, even those with like gout, psoriasis, arthritis, anything linked with inflammation, it will also help you maybe not permanently get off. Maybe you stop your maintenance meds, but whenever you have a flare, like you take the wrong thing, or like if I stress Jen out a lot, she gets so stressed, then there's a breakout. Then they take the medication. But if without PPARs, then you will be taking medication every day. So there's a big difference, right? Your body sort of become normalized only when you're under stress, then you take. So that's already cutting your medication by your maintenance meds, no matter what condition that we're talking about, by like 90%. So that's wonderful, right? For all of you who are on maintenance meds, because we know we want to protect our liver and kidney. To all our viewers today, I want to share something. Since this is a Simply Nature Answers, is a bit about health. I want to share something that is radically changing in all the countries, like in Singapore and in many first world countries. This is radically changing. People are now talking about living to 120 years old. Okay, if you listen to the programs I listen to and I have to attend the conferences, everybody is very confident. Everybody is very confident in the next 5 to 10 years, we will have methods, understanding, okay, even protocols that will make sure that we live to 100 and even past that. Okay? And this is clear. Don't you realize now people in their 60s, look at Janet. I'm sure all of you know J-Lo, right?
Oh, yes.
Yeah? This woman is 50 plus. Does she look 50 plus? No, no,
Super
right?
young.
No, so Chris Hemsworth, all these actors are no longer young, but they actually look good. Why? Because we are all across the world, our understanding of how to stay young and stay healthy is actually improving. So within the next 5 to 10 years, many people believe that we're going to have a breakthrough to be able to have understanding for you to live 80, 90 years old. It's very likely. Okay, so what does this mean? This means you have to take care of your liver and kidney. Okay, you have to take care of your liver and kidney, because if your liver and kidney is damaged, it makes looking young very difficult. Okay, so if you want to be young, don't you notice those who go and party, drink a lot of hard liquor, they look old? Those party animals, those who go disco all the time. J-Lo has a very strict and healthy diet, huh? That's why her new husband, what's his name? Ben Affleck, right? Cannot take it because he's an alcoholic. Okay, I shouldn't be saying these things afterwards, but they're in the States. I think we are safe in Philippines. Okay. Anyway, it's in the newspaper, right? Okay. Yeah, so
Okay.
so that's it. Okay, I'm digressing. I think Sheila's telling me stop, Sashan. Let's on to the next question. Okay.
Well, of course, we want to answer a lot more questions from our viewers today. They are taking advantage that we are answering a lot more about PPARs. Okay,
All
so
right.
the next question is related to fatty liver. It's kind of specific because the question is, can 10 bottles of PPARs tablet solve the fatty liver? Is it possible?
It is possible, but I can't guarantee you that it will happen. Okay, because there is something, don't forget this. Something caused your fatty liver.
Mhm.
Okay, so will PPAR tablets help with fatty liver? Yes. Okay, but if your lifestyle does not improve, the speed at which the PPAR can help you reverse your condition will be affected. Right? So if you really cut down on fatty food and all that completely, okay, bad fatty food, and cut down on your oils at least for the next 3 months, then it is possible the 10 bottles of PPAR tablets will give you good results. Next, your condition of your liver. I don't know what stage is your liver at, right? If it's at the later stages where it's liver cirrhosis, then it's very difficult. Okay, but if it's in the early stages, and I don't know how fat is your fatty liver. Okay, so if it's just mild, then definitely it will help. Okay, now what happens when a condition gets worse? All right, so let me share with you. It doesn't mean that PPAR tablets won't help. Let me give you an example to make it easy to understand, right? If you are slightly overweight, then to bring you back to normal weight, just eat a bit less for the next 1 week long. Simple, right? If you are grossly obese, not only do you have to go on a diet, you have to exercise also, right? And not only do you have your diet, it's not only about eating less, you really have to change even the food that you eat. So you get what I'm saying? So if you're only slightly overweight, just adjusting the volume of food that you eat, you're going to go back down to normal. But if you're very, very big, you need to really change even the food that you eat. And not only that, you even have to exercise. So what I'm saying is, I don't know how fat is your fatty liver, but I can tell you one thing, the PPAR tablets will help. All right, the PPAR tablets, and you should do something about it before you go into liver cirrhosis. Because once you go into liver cirrhosis, at that point, I'm not even confident to say that the liquid can reverse. It can help you, but it may be very difficult to reverse your liver cirrhosis. If you ask any medical doctor, they will actually tell you liver cirrhosis is irreversible. Okay, so don't reach that stage. Okay, so yeah, take the tablets, go for testing. If you're not getting the results that you want or fast enough, make other changes, including going up from tablets to soft gel or even liquid or PPAR powder. At the same time, you will probably have to adjust your diet and do go for exercise. All right, I can share with you, I exercise 1 hour a day, every day. Okay, because I like to eat. So in order to eat, I must exercise. But let me share with you a secret, right? My exercise is actually pleasurable. Why? I go to the treadmill, and for that 1 hour, I read my manhwa, my comics. Okay, so the 1 hour goes by. That's my time. I don't know, maybe you like to read a novel, or you want to watch 2 episodes of Friends or Big Bang Theory, or or watch half a movie every day. That 1 hour you watch Netflix while you're walking, so that time goes by very easily. Okay, so that's how easily I get in my 5 kilometers or 10,000 steps a day within an hour. That's my time where I actually read the things I like to read. Okay, then the rest of the time I can go back to work. Okay, thank you.
It's actually a good tip, sir. For those of you who thinks that it's very depressing to start off with your exercise, most especially in this holiday season that they'll be eating a lot.
Everybody thinks that you have to run like crazy and do
Right.
weights and things like that. No. Brisk walk, but it's really brisk walk. It's not slow strolling. It's walk. I walk at 5 kilometers per hour speed, and I use a treadmill so I can measure. So, and then I incline it at 2. So it's like walking fast up a hill continuously for 1 hour. Okay. Yeah, but it's not like painful like running. Running after 5 minutes, or for most people, after 3 minutes, you want to die already. Your lungs want to explode. Okay, it's not so painful.
Right. Okay, thank you, sir. Okay, next question. Thrown to us privately. The question is, are there any specific precautions that need to be taken when starting PPARs alongside existing maintenance medications?
Okay, the answer for cholesterol is no. For blood sugar, one thing needs to be monitored. Okay, if your blood sugar is okay, your drugs that you're taking will bring down your blood sugar. Okay, so let's say the doctor gave you a dosage because your blood sugar level is 9. The doctor will give you a dosage that will bring your blood sugar from 9 down to 6.5. Okay, now if the PPAR already repair your body and your blood sugar is no longer 9, it is 7, the dosage for your metformin will still bring it down 2 points, actually 2.5 points. So now it'll become 5.5, right? Because you're 7 minus 4.5. Okay, so now you're going into hypoglycemia, low blood sugar, which will make you feel giddy and you may even faint. Okay, so for people with blood sugar, if you don't, your drugs will force your blood sugar down. For example, if you are 9, the doctor gave you the dosage to bring it down 2.5 points. So from a 9, it drops to 6.5. But if you're no longer 9 because of PPARs, you're now a 7, it will still force your blood sugar to go down by 2.5 points. So now it becomes 7 minus 2.5 is 4.5. Now you're hypoglycemic, low blood sugar. That's the only thing that you that condition that you need to monitor. All right. So to prevent you from fainting while crossing the road, all right, because you are low blood sugar, or for feeling tired because you are low blood sugar. So just adjust that. All right. So if you when you take, but the good news I share with you, right? No matter how much PPAR tablets you take, you will never go hypoglycemic because we make your cells become normal. We don't force the blood sugar down. Okay. For any other conditions from psoriasis like Miss Jen to high blood cholesterol to hypertension, there is no way you can overdose on the tablets. There is no side effect. Okay. The only side effect is you eat too much, your poo-poo is green in color because your body didn't use all the tablets that it ate. But you won't have a negative side effect. In fact, you'll feel very energetic. Your skin will glow and things like that. So there are no worries about that. My record, I take the tablets and even the liquid when I am fasting. So when do I fast? I fast when for spiritual reasons, all right? Like for Catholics, it's during Lent, right? I also fast when I'm doing a conference. Because when I do conferences, I don't have time to eat. So my average that during these times, I eat about close to 100 tablets a day, okay, for 3 days straight, because if I do a conference or if I'm fasting, right? Yeah, so I can let you know, in fact, if I do that, my pores will close, my face will glow, because 3 days of not taking nonsense, no fast food, no chocolate, no anything, right? Suddenly your skin will be very smooth. Sorry, I'm gonna digress. Fun fact, this, if you go to visit anyone in the hospital, okay, and if they have been on IV drip for more than 4 or 5 days, like a week, look at their face. Their skin color might not be good because no sunlight and they're weak. But I guarantee you one thing, all their pores are closed. Those of you with big pores, they are closed. You know why? Because they have stopped taking food. So walang nonsense, walang toxins go into their body. But you notice, even if you're in the hospital and you're only IV drip, you still poo-poo.
Yeah.
That's interesting. You didn't eat for 3 days, but poop is still coming out. Okay, so actually your body is undergoing extreme detox because you're not putting in processed food, nothing nonsense, but yet the shit is still coming out. So your body is detoxing. So one of the side effects or benefit of detoxing is your skin becomes smooth. Your pores start to close. So next time you visit a person in a hospital in ICU, you take a look at their skin. Usually it's very smooth. The color is not good because they're not well, but their skin will be smooth. Right? Just side note.
Let me just clear it out, just like how Sir John did it. You don't have to be hospitalized or confined. Okay, you can take replace your meals with tablets, all right, to close your pores for the next few days, right, sir? Just like how you did it.
No, it's true, it's true. Those of you who are doing juicing programs for beauty's sake, weight loss sake, take lots of tablets, all right, because it's very little calories, but it gives you all the nutrients that you need. So it'll make your juicing even more effective.
Exactly. Well, actually, sir, that's our last question for today. Okay. But as you know, our viewers are combination of metabolic illness patients, and of course, we still have our cancer patients watching us today. All right. I just want to ask for very quick parting words to also invite them tomorrow right away for our webinar. Okay. Who would like to start first?
I'll go. I'll let Jen close, right? Because she'll share. Both of you, I'm sure, will share details about tomorrow, and also it's Christmas season. We have special packages for everyone. Okay. So number one, today's topic is about maintenance meds. So to everyone who came because of this topic, the good news is you can get off your maintenance meds. Okay. And we're not going to do something irresponsible like get off it tomorrow. Okay. No, we do it safely and with understanding, right? So over a period of 1 month to 3 months, we're going to slowly reduce your maintenance meds. So what you do is you take the correct PPAR tablets or soft gel capsule, depending on your medical condition, and you observe. So for those who have high blood sugar level, you do your testing every day, every morning, evening. If your condition is normal while you're on a PPAR protocol, but be it tablets or soft gel, you can start to slowly decrease the amount that you're taking, right? Now, the moment you decrease, you also have to measure your blood sugar. See, oh wow, even though I decrease my medication, my blood sugar is still normal. So that's good news. Don't decrease again tomorrow. Okay. Let it stabilize for 3-4 days to make sure that it's not because you are very disciplined about your food, all right, or because of the timing of the day. So make sure that it is really still normal, even with the slightly reduced dosages. Then you can reduce, and slowly over a period of 1 month to 3 months, you will be actually off maintenance meds. Okay. Now, this is not the case for anyone with very serious diabetes, or those of you who need to take insulin and things like that. Can we get you off your maintenance meds? Can you even possibly get off insulin? Yes, the possibility is there, but I don't want you to do it yourself, okay? Because your diabetes is on this very serious level. I will encourage you to have a doctor who knows how to use the SimplyNature PPAR protocol to guide you through this process. Once you go from very serious back to normal and borderline case, then maybe you can say, okay, doctor, I don't need to see you anymore. Okay. And then you can finish the rest of the journey yourself. But that initial stage, if you are a very serious diabetic, I would definitely want to tell you the right thing to do is to do it with a medical expert like Dr. Johnson to guide you through that initial part. After that, you can just refer to Ms. Sheila and Ms. Jen, okay? And last but not least, Ms. Jen herself shared her maintenance meds. Her maintenance meds is not metabolic in nature. Hers is immunodeficiency, and hers has a lot to do with inflammation. So our protocols can get you off painkillers because, for example, if you're arthritic, rheumatoid arthritis and all that, your pain comes from your inflammation. So if we are able to manage your inflammation through the PPAR tablets naturally, you have less inflammation, less pain. Less pain, you don't have to take the painkillers. Okay, so there you go. Even those types of maintenance meds, you can see an improvement, and over time, wean yourself off it. So with that, I hope that you are encouraged and that you got what you wanted from the title of our discussion today. And we also sidetracked with some juicy information. I hope that was interesting. Join us again in our next SNA. The dates, Sheila and Jen will share with you. Thank you, everybody. I'm wishing everybody a Merry Christmas and a Happy New Year.
Thank you, Sir Shyan. Miss Jen?
Okay, it's my turn. I think for me, it's just sad to reflect on it and regretful that it had to come to that stage of hurting, of illness, of taking medications before I start valuing my wellness. So for me and everybody, it's a reminder that each day it's still a new chance to get stronger, to eat better, to live healthier, and be the best version of us. Yeah, because if we don't make time for our wellness, we will be forced to make time for our illness. That's all.
Thank you, Mr. That's very heartfelt. And what Sir Sean shared today was actually also very encouraging. And I'm sure that you are, while Sir Sean was imparting or saying his parting words today, I'm sure that you are thinking about your loved ones. Maybe it's your parents or your kids, even your kids now who are having these kinds of conditions. I'm sure you're thinking about them and how to get their health at its best, most especially this holiday season. So because of that, I'd like to spread some good news to you all because this is very exciting because you are in for a treat. Catch our Lazada 12/12 mega sale and check our participating products. This is the best time for you to get healthy, not only for yourselves, but also for your whole family. So another exciting news on top of our Lazada 12/12 mega sale, okay? We're also offering a limited time promo that you wouldn't want to miss because if you shop now at official SimplyNature website, that's www.simplynature.asia, okay, you'll get, and spend between 6,500 pesos to 62,000 pesos. You can actually get an instant discount of 50 pesos to 500 pesos on your purchase. So the more you shop, the bigger the savings, okay? Don't miss out on that deal as it is only limited time up until December 20, okay? Now, but wait, all right, it's not over yet. We still have more good news because our gift packages, it's called Power Pack, which is good for 5 days, and Kickstart Package, which is good for 15 days. This is a combination of our basic PPARs tablets and also Cleansing Plus for detoxing, okay? These are available for buy 10, get 1. This is perfect for your loved ones, even for your friends and your your dearest close ones, no, whom you want to get healthy as well. Okay, so don't wait for the holiday rush because once again, this is the best time for the whole family to get healthy. Okay, so visit our Lazada, our Shopee, our website for all these amazing products to try on. Or if you don't know what to take or what's the best recommendation for you, just ask us here in our Facebook page, which you have to follow, like, and follow as well. Okay, so there you go. Of course, by tomorrow, I also want to invite everybody. That's Thursday, 7:30, our regular Simply Nature webinar is entitled Cancer Detection, the Right Approach. So we really, really hope to see you once again tomorrow. And we would like to, of course, thank you for joining us today in our Simply Nature Answers episode. So we hope to see you again tomorrow and know that your victories over your health battles, may it be metabolic illness, cancer, or any other, your victories over your health battles are what keeps us going here in Simply Nature. Because here in Simply Nature, we are always with you from start to healing. God bless you, everybody, and see you tomorrow.